A very good morning, all of my friends. Today we are going to learn a very important topics that's frequently asked in Viva university exams, in especially in CBDC batch. What are the trio of flatulence? The trio of flatulence. What are the medicines? They are Carbo Lycopodiums, and Syncona. So you should mention these three medicines name at first. Okay. So you should mention these three medicines with full names at first. Then we go for their differentiation and contrast. Okay. So first of all, in Carbo actually its common name is the vegetable charcoal. And in Lycopodiums, especially no, it is a right-sided remedy. Here its common name is club moss or vegetable sulfur. Okay. We call it vegetable sulfur. And in Syncona, its called common name is Peruvian bark. We know that's the great discovery of animals and where the homeopathy is originated. Okay. So these three medicines, their common name and their parts used, especially in China or Syncona, the bark is used in Lycopodiums and the spore is used in Carbo the charcoal is used, okay, for the preparation of the medicine. So this is the basic we should know from where, which family or from where its medicine is prepared, okay. Then we go for the important points, why they are called trio flatulence and their characteristics. How can we differentiate between Carbo Lycopodium and China, okay, China or Syncona. So first of all, in Carbo the simplest food disagree. In the Carbo patient, the patient cannot digest even simplest food. Okay. In Lycopodium patient, the gastric affections, excessive accumulations of flatulence. In Lycopodium patients, gastric in belly, in abdomen, there is excessive accumulation of the gas. Okay, flatulence is marked. In China, here also excessive flatulence of stomach. Okay. So Lycopodium and China, there is accumulation of the gas in abdomen or stomach, but here the position is different. Actually in Syncona, that is whole abdomen flatulence, but in Lycopodiums, here the flatulence is especially in lower abdomen. Already I mentioned in another separate one. So let's see. And here the characteristics of Carbo patients, the accumulations of gas in stomach and intestine. Okay, these are the key points. These are taken from the Allen's keynotes, Borix and others, Materia Medica. Okay, comparative Materia Medica also. So you should mention these key points, keynotes, because if you write these keynotes in exams, it's chance to increase your scores. Okay, so accumulation of gas in stomach and intestine in Carbo patients, and also in Lycopodium, there is good appetite, but a few mouthfuls fills up to the throats. The patient has appetite enough, the patient has enough appetite, but if the patient eat for some foods, after that he can't to take it up to the throat. Okay, so Lycopodium patient's characteristics is the keynote symptoms. And also in China, here the voice is fermentation and borborygmus. So you should know these key points. Then what are the sensations in Carbo patients? Sensation as if stomach would burst. Okay, the flatulence is so much that patient's sensation as if the stomach would burst. And in Lycopodium, the constant sensation of satiety and feels bloated. In Lycopodium patients feels that it's enough. Okay, the person feels that the satiety and feels bloated. Then we see that in Carbo patients, the temporary relief from blanching. So the important point is in Carbo patients, the temporary relief from blanching. It is the most important keynote you should mention in medicines. In Carbo the temporary relief from belching. In Lycopodiums, no relief from belching, and Syncona also belching gives no relief. So these are the three medicines where we can easily differentiate. In Carbo the most important point is that temporary relief from belching. If the patient belches, so it gives him temporary relief. Okay, at the flatulence differentiations. And in Carbo the flatulence in upper abdomen. Okay, in Carbo patients, Lycopodium, the flatulence in lower abdomens, and in Syncona, flatulence in whole abdomen. Okay, Carbo upper side, Lycopodium lower sides, and China full whole abdomen. Okay. Then what type of discharge comes and other characteristics. In Carbo patients, excessive discharges of fatty flatus during past the stools. The patients feels very flatus, very sounds. So this is the characteristics of Carbo patients. And in Lycopodium, the patients immediately after a light meal, abdomen is bloated. Generally, Lycopodium patients after taking the meals, he feels that abdomen is bloated. Okay. And in Syncona, much flatulent colic. Here the Syncona patient, where the colic is, and colic is especially periodic colic. The colic comes in recurrent again and again. That's why I give the star. Here you can see the periodic pain. Okay, periodic colic, mass flatulence, colic. So you should know the pain. What is the difference between pain and colic? Actually, colic is nothing but the pain coming from the tubular structures, especially in our organs, abdominal organs, the pain of abdominal organs, and it's recurrent, it's periodic. Where the chincona, we know the periodicity is marked features, and better by bending doubles. The patients better by bending doubles. If the patients bends double, so it ameliorates its complaints. Okay. And also in carbo veg patients, desire for salt, where the lycopodium desire for sweet, and cinchona patients desire for sour. Characteristic symptoms. Okay. And carbo veg beta test in mouth. In carbo veg patients, where always the in mouth the beta test is marked, and here the lycopodium the sour test, and in cinchona beta test in mouth. Okay. So carbo veg and cinchona patients has beta test in mouth, and lycopodium sour test in mouth. Okay. And other characteristics are in carbo veg patients debility due to organic causes, especially in collapse. Actually, carbo veg where we give carbo veg especially in last stage of any disease, any complaints, where the prostate and debility is marked collapse stage. Okay, loss of vital fluid. So debility due to the organ of causation. What are the causations? Okay, in lycopodium patients, ailments from bread, onion, spirituous liquor, etc., etc. And in cinchona patients, here the functional debility due to the loss of vital fluids. Both debility is marked carbo veg and cinchona, but in cinchona especially loss of vital fluids. Okay, or here carbo veg the collapse stage are seen, and also carbo veg patients always wants to fanning, that is very closed. Okay, closed fanning is needed in carbo veg patient. Then we will go for modalities. In carbo veg patients, there is aggravated, the symptoms aggravated or increase by fat food, lying down, abuse of quinine or mercury, warm, damp weathers. So these are the aggravating factor. Fat food aggravate the complaints in carbo veg, and ameliorated by belching. We know the belching gives partially or temporary relief, and also being fanned rapidly. This is close distance. It is a very important symptoms, because where another medicine also there, where the fanning is needed in far distance, not closed, that is lachesis. Okay, so you should remember the fanning is needed very close distance in the case of carbo veg, and far distance, that is the lachesis. Okay. And here in lycopodium, where we can see very important, we should know the modalities. Lycopodium patients, that is aggravated the symptoms of the flatulence or the colic aggravated of 4 to 8 p.m. cold drinks and foods, and oysters. Okay, oysters is very important in lycopodium, and ameliorated from warm food, drinks, uncover head, and loosening garments. Always lycopodium patients try to loosen her dress. Okay, always try to wear the choga chapkan, like big dress. Okay. And in cinchona patient, where the aggravated from slightest touch, loss of vital fluid, we know it is a very important causations, loss of vital fluid that aggravate the complaints. And also here periodicity is marked, and ameliorated from hard pressures, and bending double ameliorated the complaints in cinchona. And also if we see the sleep in carbo veg patients, sleep propped up. Okay, when he slept, the sleep quality is prop up sleep. Okay, in lycopodium the sleep on the right side, especially patients lying right sided. Okay, in cinchona there is no specific sleep. So these are the differentiation among these three medicines that are the trio of flatulence. So if you want to get these full HD quality notes of this one page, so you just check the YouTube descriptions. I will put the link. You can easily download the HD quality notes. So thank you all of you. Study well, and see you again in another videos.